As you saw quickly on the next slide, hospital to home, is Fonda Harris.
I am Dr. Fonda Harris, and this is Hospital to Home, creating a pathway to housing and health for patients experiencing homelessness. There are an estimated 2,200 homeless people who are living in our streets or in shelters here in Nashville-Davidson County, 1/3 of whom are chronically homeless, and many of those are also chronically ill. Like many medically fragile people who are experiencing homelessness, not having adequate or stable housing only exacerbates their medical conditions. It also leads to high uncompensated care costs to our healthcare system. Now, while we want our city to be a city that is both compassionate in its care as well as effective, the way it stands, it currently is not. Instead, there is a disconnection between the healthcare and social services systems that provide a care for our homeless people, creating a revolving door where the homeless are going in and out of hospital emergency departments and or being readmitted to hospitals at a high cost burden to our city, and the homeless patient is not getting fully well. The results, poor outcomes for our patients, poor outcomes for our health system, and poor outcomes for our social services agencies. We are a city that values human life, and that is why it is the vision of the Hospital to Home to create a community where medically vulnerable patients that are experiencing homelessness have access to optimal health and housing. Our team is comprised of the following organizations and the following individuals: Judith Tackett, Les Head, and Molly Martin from the Metropolitan Homelessness Commission, Christine Lalonde from the Mayor's Office of Innovation, Jennifer Hampton, who has represented the Nashville General Hospital, Sabrina Edgington of the National Healthcare for the Homeless Council, Bill Friskus Warren from Neighborhood Health, Rachel Hester, Martina Condron, and Kathy Link from Room in the Inn, and I represent the Nashville Public Health Department. We have met consistently since the spring on a weekly basis, and we are dedicated to implementing our business plan, which is a collective impact model. The goal is to build on existing programs and partnerships that are already in our community to establish a cohesive, connected, effective, and efficient response to our most vulnerable Nashvillians. We expect the following benefits to the community. Medically fragile and chronically homeless Nashvillians will experience a coordinated system that improves their health and welfare. Hospitals will see a reduction in high utilizers in our emergency departments. Nonprofits will receive appropriate referrals to their agencies, and medical and social services agencies will know how to properly connect a homeless person to a primary medical home. In short, the Hospital to Home links people experiencing homelessness who are at risk of dying in our streets with supportive services and outlines a path to housing. Thank you.
Thanks so much.